Today we are going to learn a very beautiful system of the pain management that is called battlefield acupuncture. This is the very significant system and even creating long lasting results, and we are getting the results within 30 seconds to 5 minutes. So dear friends, I am Dr. Hemant Sharma from Vadodara, Gujarat, and you can see my all the courses. There are lots of free courses available and free and paid both courses available on my website, that is courses.sarmahemant.in. So this battlefield acupuncture is invented by the Air Force flight surgeon by the Dr. Richard Nimto. He is a very famous doctor and has invented this wonderful and rapid pain relief technique. And he himself has treated thousands of patients and given this therapy to this world. Now we are healing many people every day in our clinic. So I have treated more than 2,000 to 3,000 people just with the battlefield acupuncture. And initially I was thinking there might be only pain management, but I have seen there is a very significant as well as the results are long lasting. So do not think this therapy just as a painkiller method, because many times we are thinking the fixed 5 points, because in the battlefield acupuncture we are having fixed 5 points for all types of the painful disorder, whether the person suffering with the rheumatoid arthritis or the osteoarthritis. There might be two types of the pain. Number one, the physical pain, and number two, there might be emotional pain. Many times people are emotionally stuck and suddenly they start feeling pain and the heaviness in the shoulder, the heaviness in the chest area, and immediately migraine headache because of some emotional blockages. So during these all need, we can use the battlefield acupuncture. So the limbic system is the most powerful part of the human body. Like if we see generally, like suppose this is the brain and this is the emotional brain. So we can consider this is the brain or the master brain who is connected with the reasoning, who is connected with the thinking, and who is connected with the calculations. And this master brain is working on give and take condition. Give and take condition means everything, you are doing the accounting for everything. You want to give something, okay, you will take something. Okay, you want to do something for someone, but what benefit you will get in the reverse. So the master brain always doing lots of thinking, lots of accounting, management. So when we are praising someone, oh, you are very genius. So in the reality, we are praising the master brain or the cerebrum. So cerebrum is the master brain and we are praising the cerebrum when we want to praise the memory. But definitely now it be coming to the emotional brain. Emotional brain is more powerful. Emotional brain is more powerful than the master brain or the cerebrum. So the other name of the emotional brain is also limbic system. So when person, we have seen the person in the love. So the love will hijack your whole brain. Now you will not having any other feeling other than loves. So love is the part of the limbic system. Love is the part of the emotional brain, but now your whole brain is hijacked. In the same way, when we are in the different emotions, suppose we are in the fear, suppose we are in the hatred, or any types of the emotions, so it will influence our whole brain. So emotional brain is always more powerful. We are very talented. Even after that, we are very talented. But even after that, if we are emotionally breaked, then we cannot perform, we cannot give our 100%. So emotional brain is more powerful. So Dr. Richard has thought about this and definitely he has gone the deeper understanding of this, and he has given the many points, means out of 5 points, you will see there are minimum 2 points just for balancing the person emotionally. So let's start with the limbic system first. So the limbic system is having many parts. Like the limbic system have cingulate gyrus, thalamus, hypothalamus, amygdala, and the hippocampus. There are many parts found in the limbic system. So if we go through with all the parts very quickly, then I would like to tell you the hippocampus is connected with the memory. So if hippocampus is good, then the person is having very good memory. So the limbic system or emotional brain is also giving you good memory with the help of hippocampus. So when someone coming to you asking, can you do something for my memory? Yes, definitely. That time we are putting the point of hippocampus to enhance the memory. Now, the second part is the amygdala. So amygdala is the part of the brain, part of the limbic system, which is connected with the fear. And this is especially developing till the 7 years of the age, 7 years of age. Suppose some child is living continuously under fear till the 7 years of age, then this amygdala will be developing fully and full of fear. Now this amygdala will influence whole life. When the person need to do something very good, suddenly might go in the depression, and the amygdala will affect the life. So amygdala is connected with the fear emotions. Now, if we talk about the thalamus and the hypothalamus and the hypothalamus are very important part of the limbic system. So we have one thalamus and another is hypothalamus. Both are very important part of the limbic system. So thalamus is connected with the outer feelings, and hypothalamus is connected with the internal feelings. The internal feeling means, suppose someone in the love, that is the internal feeling. Someone in the joy, hatred, happiness, that all are internal feelings. So the hypothalamus is connected with the internal feeling, and when you are in these different types of the emotions, you might feel different types of the energies. When we talk about the thalamus is connected with the outer stimulus. So suppose you are fighting with someone and someone is hitting you with the stick, then you are feeling the pain. Oh, so this pain is felt by thalamus because thalamus is connected with the outer stimulus. So all types of the outer stimulus, like the pain coming from the outside, like the temperature, we can feel the temperature from the outside. We can touch some surface and we can tell, oh, this is the hot or this is the cold. So these are the outer stimulus which is connected with the thalamus, and the internal stimulus connected with the hypothalamus. In this way, so when we want to relieve the pain of someone, so most of the time we have to also work on the outer stimulus. Suppose we are running and suddenly got injury. We got the sports injury. Then sports injury means outer stimulus. So we have to work on the thalamus. So Dr. Richard also have used this concept, and he has also taken the point thalamus, which we are going to learn shortly. So right now we have clear understanding. Thalamus means outer stimulus, all types of the outer stimulus like the pain, temperature, and all. And hypothalamus means internal stimulus or the emotions like love, hatred, and all. So these are the internal emotions. So when we talk about the limbic system is the very strongest part of the human body. In the battlefield acupuncture, we have used the 2 points from the limbic system. The point number 1 is the cingulate gyrus, and point number 2 is the thalamus. So let's see here. The cingulate gyrus is the part of the limbic system. We can see this is the brain. So this is the outer part of the brain, or the cerebrum, which already have been divided in the multiple parts, like the frontal brain, like the occipital brain. And if we are going next, then we can see this is the cingulate gyrus. So cingulate gyrus is the part of emotional brain or the limbic system. So it is connected with the emotions. It is connected with the learning and memory as well. So when we are studying the battlefield acupuncture, first we are doing the stimulation of the cingulate gyrus, because we know most of the people, more than 70–80% people are having pain because of emotions, because of emotional breakdown, or there is emotional connection with the pain. So our first point will be cingulate gyrus, and we will balance the emotions. Then our second point, we will talk about the thalamus. Thalamus is connected with the outer stimulus. So in first 2 points, we will balance the person emotionally as well as physically, means from the outer stimulus. So let's see first point, that is cingulate gyrus, which is the part of the limbic brain. So look at here. So cingulate gyrus is connected with the emotions and the sensory put. Because of emotional responses, we are feeling some pain, and our target is pain management here, right? So if we see in the ear, I will also do the practical demonstration. That time you will understand this point. So the first point is a cingulate gyrus. Here we can see. So this is the first point, that is a cingulate gyrus. We have to put this point first, and this point will balance the emotional stimulus, which is responsible for the pain. So first look at here. You can see the point cingulate gyrus here. This is the point cingulate gyrus. So first our target is this point, that is cingulate gyrus. So now let's see, rotate this image and look at once again here. If I rotate this image, then you can see here. If you see this image, this point is located not inside, but the outer side. Okay, so we will see the image once again for clear understanding. Look at here. If you see, this part of the ear is called tragus. And this part of the ear is called antitragus. So this is the tragus and this is the antitragus. And in between the tragus and the antitragus, we can see this is the notch. We can tell intertragus, or we can tell it intertragic notch. So notch between two tragus, that is called intertragic notch. But our cingulate gyrus is not located in this notch. Remember, because by mistake, if you are going inside, that will be the wrong location. If you are by mistake going inside, that will be the wrong locations. So do not go inside. We have to be outside only. So we have to be here outside only, here only, on the junction. Here, I will do the practical demonstration. That time you will able to understand. Right now, just try to understand this. The cingulate gyrus point located on the border, on the outside, not on the inside of this intertracheal notch. So this is the first point. This is the first point. Now, so what we are doing in the battlefield acupuncture, when the patient coming to us, so as soon as patient coming to us, we are putting the cingulate gyrus, or in the shortcut, we can tell it CG or cingulate gyrus. As soon as we put this point, we will balance the person emotionally. We will balance the person if having pain because of the emotional responses. Okay. So we will put in any ear. It doesn't matter. You are putting in the right ear, in the left ear. Patient is telling you, doctor, I'm having pain in my right knee. So it doesn't matter whether you start from the right knee or from the left knee. You can start from any side. You can start from the right side and you can start from the left side. So we will put the cingulate gyrus in the right ear, and then we will tell the person, okay, now move your knee area, which is painful. And we will wait 20 to 30 seconds. The person will move the knee area, and after 20 to 30 seconds will tell, oh, I am having no any relief. Pain is still there. There is no any relief. If we are getting negative feedback, then we are putting the same point in the other ear. In this way, we are proceeding point by point, step by step. So we are having total 5 points. We will start our journey from the cingulate gyrus. So we are putting in the right ear first or the left ear first, as per our choice, randomly. There is no any rule that you have to start from right ear or the left ear. You can start from any ear, right? So we have started from any ear. Now we will proceed. Okay. So the first point will be cingulate gyrus. Now we will move ahead and we'll see the point number 2. The point number 2. Now we are moving ahead and we are moving to the second point, which is called thalamus. The thalamus point is connected with outer stimulus, as I told you. So when we are putting the second point, or the thalamus, which is connected with the outer stimulus, then mainly it is working for the chronic pain, and we can remove old pain, the old rheumatoid arthritis pain, or the osteoarthritis pain, and the pain arising from the internal organ with the help of this point. So this is the second point, thalamus, right? We have seen most of the time, most of the patients are reporting us relief at this second point. Means many person might not have the relief on the first point, but we will see this many number of patients are telling us, oh, now I am feeling better as soon as we put the thalamus point. So let's see the location of thalamus point. We already understood the thalamus is the part of the brain which is connected with the outer stimulus. So when we are having injury, when we are having any types of the pain, thalamus will pass that sensation till our brain. So now if we see in this image, then we can see this is the location of thalamus. But the question is this, whether the thalamus is located here. The answer is this, thalamus is here, but not on the exposed side, but on the inner hidden side. So thalamus point will be located on the inner hidden side. So I will do the practical demonstration of the second number point, that is called the second number painkiller point, and most of the time the results are appearing at the thalamus point. You can see the location of thalamus here, but this point is not located on this exposed side. If we want to see the real location of this thalamus point, then we have to go inside. Now you can see there is now thalamus point is not visible. But if we go inside, now we can see the thalamus point. So thalamus point is located on the inner side, inner side. So how to know the exact location of this point? So what we are doing? First, we are climbing on the top of this antitragus. The name of this part is antitragus, or the AT, or the antitragus. Antitragus. So we will climb here. Now we will get down on the hidden side, on the opposite side. So we will go step by step, and we will reach as the bottommost area. So we will reach here at the bottommost area. So this is the point, thalamus. So this will be our second point. So we will start our journey from the cingulate gyrus in the right ear. Then the person will tell no relief. Then we'll put the cingulate gyrus in the left ear. Still person is telling no relief. Every time we are waiting 20 to 30 seconds. Now, after putting the cingulate gyrus, our patient is getting no relief. Then we will proceed to the point number 2, that is thalamus, and we'll put the thalamus here. Again, we started from the right ear, so we'll start the thalamus again from the right ear. Now, we'll ask the person, okay, how do you feel now? The person is telling no relief. Then we'll put the thalamus in the left ear. So always remember, if we started our story from the right, then always start from the right. So the right cingulate gyrus, then the left cingulate gyrus, then the right thalamus, then the left thalamus. We have inserted 2 point here, 2 point here, but still patient is having no relief. Now we'll proceed to the third and very great painkiller point, that is called omega 2. So let's go ahead and see the omega 2. So omega 2 is the very great painkiller points. This omega 2 especially very, very useful if someone is having pain in any bones. In the human body, we are having 206 bones. So the person is having pain in any bone or the joints between the joint between the bones. So omega 2 is the very good painkiller point, whether you want to treat all the 206 bones or the joint in between these 206 bones. So omega 2 is very good for all the muscles pain or the muscular pain, pain in all the 206 bone, whether the person is suffering with the rheumatoid arthritis or the osteoarthritis, or there is any types of the inflammation in the limbs. Like suppose someone is having redness, swelling in the wrist, any redness, swelling, pain in the ankle joint or the knee joint or the hip joint. So if there is any problem of the upper limb or the lower limb, so this omega 2 has been considered as a very good painkiller point. Let's see the image of this. So we can see this is the ear apex. This is the ear apex. Now, if we see the outermost covering of this ear is called helix. This is the helix. Helix, or we can tell it outer rim of the ear. This is the outermost surface or the outer rim of the ear. Now, if we go in the top, that is the ear apex, the apex of the ear. So just before the ear apex, if we go just before the ear apex here, that is the location of omega 2, the third painkiller point in the battlefield acupuncture. With the help of this, we can treat all the joints pain, whether because of the rheumatoid or the osteoarthritis or any types of the inflammation, or because of the uric acid or any other types of the inflammation, we can treat with the help of this omega 2. So let's see the location of this point. This is the third number point. So we can see this is the ear apex. And just before the ear apex, we can see here, this is the location of omega 2. Let's go and see in the other image. This is the same point, which is the very great painkiller point. Look at here now. If we see here, this is the ear apex. Ear apex. And just before the ear apex, we have the location of omega-2, which is the very good point for all the bone. If we rotate the ear like this, then we can see this point is located on this helix surface. So this is the ear apex, and we can see this is the location of omega-2. Omega-2. Remember, this is the location of omega-2 because in the ear we have omega-1, omega-2, omega-3. There are many points with the name omega available in the ear. When we are doing counting, so we always start our counting of the helix from here. So this is the helix. This whole part is helix, or the outer rim of the ear. So this is the omega-2. In this sequence, we will meet with the omega-2 before the ear apex. We are also using this point independently for many painful joint conditions, right? So let's go ahead and see the fourth number point. We are keep on adding the point, still patient is not getting the relief. So we are going till the fifth number point, right? And always we are adding the point in the right ear, then the left ear, then the right ear, then the left ear. I will also tell you the sequence at the last. Let me finish all the 5 points. So now I would like to proceed for the fourth number point, that is called point 0. So let's see here. So if you see in this image, the point 0 means the solar plexus of the human body. If the core is not balanced, then the person might suffer with the shoulder pain or the hip pain or the pain anywhere in the body. Female might suffer with the uterine problem and the migraine headache more commonly. So solar is really very important part. In the same way, when we look at the ear, so this is the solar of the ear. If we balance this, if we stimulate this, then we are balancing the core of the human body. So this is our solar plexus or the point 0, right? So this is our fourth. I have written here painkiller point exactly. We cannot tell directly painkiller point because it is the homeostatic point. Homeostatic point who balance whole body, right? So this is a homeostatic point. We are putting the 0 point. Many times after putting the 0 point, we are getting relief in many problems, right? So it's a very simple point, just the center part of the ear. So I would like to show you the image of the point 0. Then after the point 0, we will learn the last point, that is, and after that our battlefield acupuncture, all the 5 points will get completed. So let's see the location of point 0. So we can see the point 0 means the center point here. From the point 0, our this helix is starting. So the starting of helix is from the point 0. Point 0 is the point who balance whole body. That's why it is called homeostatic point. We can see this is the center point of whole ear. So it is balancing the whole body. Now we can see here, this is the point located centrally. So point 0 working for the human body like our solar plexus working for us. If our solar is balanced, then we will not suffer with any types of the problem. So the last point is Shen Man. What is a Shen Man? The meaning of Shen Man means spirit gate, the gate of the spirit. When we are, many times we are too much stressful, that time we need to calm down us emotionally. So the Shen Man means the gate of the spirit. And Shen Man is the tranquilizer point who is removing the stress, pain, anxiety, depression, restlessness, and inflammation. So just many times we have seen if we are sleeping nicely, then we are feeling relaxation in our pain. So Shen Man, what the Shen Man is doing, it is tranquilizing our mind. So it is calming down our mind. So many times we are having relaxation in the pain because of the tranquilizing effect. We are getting very good sleep. Our restlessness from the heart and the body and the mind is going just by the Shen Man. So if we see it in this image, this is the location of Shen Man here. So this is a triangular fossa, and if we divide the triangular fossa, I will show you in the practical demonstration here. So this is the triangular fossa, and in the triangular fossa we have Shen Man here. So the meaning of Shen Man, the gate of spirit, who is balancing it emotionally. So these are the 5 points. Okay. So let me demonstrate you this point, then I will show you the technique, how we are doing the stimulation. So let's see here. If you look at in this image, then you can see the location of Shen Man here. This is the triangular shaped structure in the ear. This triangular shaped structure in the ear is called triangular fossa. And Shen Man is located inside here, right? Let's see in the other image. If we look at in this image, so first what we'll do, how to locate the Shen Man very properly. So this is the triangular fossa. Divide in 3 parts, the Shen Man located in the upper part. Shen Man located in the upper part. So this is the location of Shen Man. Shen Man means who is tranquilizing our heart and mind. So in this way, when you are doing the battlefield acupuncture, we always stop. We always end with the Shen Man. And as soon as we put the Shen Man, most of the time, person is getting complete relief. So let's see the quickly sequence here. So let's see now. So when you want to do the battlefield acupuncture, always start from the cingulate gyrus. It doesn't matter the pain is in the right side or on the left side. It doesn't matter. You can start from any ear. You can start from any ear. So suppose you started from the right ear. Suppose I started from the right ear. And I started with the point that is cingulate gyrus. Then I will stay 20 to 30 seconds and I will ask the patient to move the affected part and see whether there is changes or not. Then the person is telling there is no change. Then we will put the same point in the left ear. Same point. Still patient is telling no relief. Then we are moving to the next point. The next point will be thalamus. Again, we will start from the right ear. Patient is telling no relief. Then we put in the left ear. Still no relief. Then we'll put the third number point. Our third number point is omega 2. We will start from the right ear and patient is having no relief. No relief. Then the left ear. Still no relief. Then we'll go ahead and we'll go to the fourth number point. That is the point 0, Again, we will start our journey with the right ear, then the left ear. Patient is telling still no relief. No relief. Then we are moving ahead and moving to the last point, that is Shen Man. Then again, we are starting our journey right ear, then the left ear. If patient is telling no relief, then just we are waiting for 10 more minutes for the feedback. So this is the sequence when the patient is having no relief. The sequence will be cingulate gyrus, thalamus, omega 2, 0.0, and the Shen Man. Sequence will always remain this. But suppose the patient is getting relief. Now, the another patient, we started our journey with the right ear and we put the cingulate gyrus. Patient is telling no relief. Okay, no problem. Left ear. Again, cingulate gyrus, no relief. Then our next point will be thalamus. As soon as we put in the right ear, patient is telling 20% relief. Now forget this ear, forget other ear. Now just treat the same ear. Treat same ear and put all the remaining point here. All the remaining point here. So we have already completed the cingulate gyrus. Now the second point is the thalamus. Now the 0.0. Sorry, thalamus. Then the omega 2, 0. And Shen Man we have to put here only in the same sequence. No need to put the point here. Whatever we have already inserted, let it be there. So let's see the sequence. Now I will do the practical demonstration. Then if you have any confusion, then also I will discuss with you. So we can use this Beccaria seeds, or we can use these Sujog needles, or we can also use these longer needles, okay. So anything we can use for this treatment purpose. So let's start with the so I'm showing you the treatment with the help of needle, but you also can use seeds. So my first point will be this, cingulate gyrus here. So cingulate gyrus will be just on the union of this here. And this point is a little sensitive here. So let's see now. So first I will put the point here. Look at this. So this is the point, the first point, that is cingulate gyrus. Clear? Now, suppose we started from the right ear. Now the person is telling, I don't have any relief. Then what to do? The same point we have to insert in the other ear, same point. So this is the right ear. After putting the point of cingulate gyrus, now the patient is telling us, oh doctor, I don't have any relief. No problem. Go in the other ear. Put the same point, cingulate gyrus. Still, there is a no relief. Now what to do? Next point, that is the thalamus. So now we will go to the next point. So this is the brain. Now the thalamus will be here, but on the hidden side. So we'll go on the hidden side. So this is the brain, or this is the antitragus. From here, we will drop down, and we will see on the bottom. We will reach on the bottom. So look at here. So I am stretching the ear so you can see here. So we'll reach on the bottom and we will put the thalamus point here. So this is the location of thalamus, just in the bottom area. Let's see now. So from here, if we go on the bottom area, that is the second point or the point thalamus. I will stretch the ear, you might be seeing. This is the thalamus. Okay. So we have added 2 points. The first point was cingulate. The first point was cingulate gyrus, this point, and the second point was the thalamus. Now the same point we will insert in the other ear. Still patient is telling there is a no relief. Then we will go to the third number point. The third number point will be omega 2. So from the ear apex, so this is the ear apex. If we just drop down one step, that is the location of omega 2. So first we are touching the point on the ear apex, just dropping down very little. So this is the location of omega 2. You can see I have inserted the needle. This point is very good for all the 206 bones, all the joints, all the muscular pain, and all the skeletal pain. So this is our third number point. The same point we will insert in the other ear if the person is having no relief. Now, we will move to the fourth number point. The point will be 0. So the center of the ear point will be the 0, or we can see here where our this helix starts, where this crest of helix start, that is the location of point 0 here. So this is the fourth number point, or the second last point. There is the point 0 here, we can see here. The same point we will put in the other ear. The patient is telling, still I don't have any relief. Then we will put the fifth and the final point, the last point, that is the Shen Man. So this is the triangular fossa. In the triangular fossa, we can see this is the point. If you see the triangular fossa, as soon as the triangular fossa start, this point Shen Man is located in the upper part. So this is the tranquilizer point and the fifth number point. So look at here, done, over. So in this way, we have covered all the point here. And this is a great technique. One minute. So this is the last point, there is a Shen Man. So this is a great technique. Just we started our journey with the cingulate gyrus, then the thalamus, omega 2, then the point 0, and the last point is Shen Man. Okay, so look at the image, look at properly. If you have any doubt, then you can ask me. Any doubt in the location? No, thank you. So this is the omega 2. From the ear apex, just you have to drop down one step, only near about 1 centimeter down from the ear apex, that is the location of omega 2. Thalamus point, I told you, this is the brain. If you drop down from the brain on the hidden side, in the lowermost point on the bottom, that will be the thalamus. The insertion is very, very superficial. We are inserting the needle with the in the slanting manner. Slanting means only 15 to 30 degree, only 15 to 20 degrees slanting manner. And the needle will be very superficial. Results will appear just by the superficial needling. No need to penetrate cartilage. This technique is very good for the mental disorder as well, because of the cingulate gyrus is the part of the emotional brain. Even the thalamus is also connected with the emotions. So we can consider 2 points. The cingulate gyrus, the thalamus are connected with the emotions, and omega 2 connected with the physical pain more. Shen Man again connected with the brain and emotions. So this is the complete package.